All right, September is Prostate Cancer Awareness Month. Paige spoke to Dr. Andrew Lee at the Texas Center for Proton Therapy to learn about advancements in treating the disease.
I'm at the Texas Center for Proton Therapy, and I'm excited to introduce you to Dr. Andrew Lee, who's the medical director, as well as Dr. Mark Vaccaro, who is a patient here at the Texas Center for Proton Therapy. Good morning to you both.
Good morning.
Let's talk a little bit about prostate cancer. Of course, September is Prostate Cancer Awareness Month. Tell me about what are some common symptoms people should consider to determine if they might be a victim of prostate cancer.
Well, usually prostate cancer, thankfully, is caught relatively early. By the time patients are having symptoms from prostate cancer, usually it's pretty advanced. The best way to detect prostate cancer early is a combination of doing a routine blood test called a PSA, as well as a digital rectal exam to examine the prostate for any abnormalities.
Well, what is proton therapy, and why is it a good choice for treating prostate cancer?
Proton therapy is a type of external beam radiation that uses small subatomic particles accelerated to very high speeds to target cancer cells. And for prostate cancer, it can give a very high dose to the prostate, but minimize exposure to the surrounding tissues, such as the bladder and the rectum. And thereby we can achieve high cure rates, but at the same time minimize the side effect profile for patients, and that therefore they can preserve their quality of life not only during their treatment, but afterwards as well.
Dr. Vaccaro, why did you choose proton therapy as an option for treating your prostate cancer diagnosis?
When I found out that I had prostate cancer, I had to look into the latest treatment methods, even though I myself am a medical doctor with specialty in diagnostic radiology. I consulted my urologist and 2 radiation oncologists. I came to the conclusion that proton therapy was the right choice for me. I wanted a treatment that had minimal, if any, side effects, such as urinary incontinence. Since proton therapy with pencil beam technology is a much more precise way to deliver radiation to the prostate, there is less chance of damage to the bladder or bowel, and less chance that I will develop a secondary malignancy at some time in the future, secondary to the radiation.
So what has your experience been like here at the Texas Center for Proton Therapy?
My experience at this center has been uniformly excellent. I am fortunate to be receiving outstanding care by my physician, Dr. Lee, who is internationally recognized as a leader in proton therapy. The nursing staff consistently provides high-level care, personalized to each of the patients. The radiation therapists are an amazing, multi-talented group of professionals. They do their job right the first time. When they position me precisely on that table, I know I will be receiving the dose that my doctor has prescribed.
Dr. Lee, how can a patient make an appointment?
Patients can make appointments through our website, or they can call the center directly, so you don't need a doctor's referral. However, if they would like to work with their primary care physician, their surgeon, or their oncologist to set up a referral, we can also help facilitate those appointments as well. Our intake office is very experienced, and they help patients accumulate all the information that's needed in order to set up the first appointment.